significa el sol.
Maria Carolina shows the masks she's made by hand to help protect her community. She's 34, a single mom and a farm worker in the US since 2018 from Guatemala. This past year, she's seen COVID hit hard.
Es muy duro.
It has been so difficult living through the pandemic because the protection was just not there, and it was so easy for any of us to become ill.
In Florida, where she lives, 41% of COVID cases are Latino, but only 22% of those vaccinated are Latino.
There's still vast discrepancies between various racial and ethnic groups.
A new analysis from the Kaiser Family Foundation shows it's the same for Latinos in almost every state. Colorado, 42% of cases, only 10% of vaccinations. In Arizona, 14% of vaccinations have gone to Latinos, but they make up for 40% of cases. North Carolina, 6% of vaccinations, 21% of cases.
So why is this happening? Well, there's several contributing factors: availability, lack of information in Spanish, vaccine times that conflict with schedules of a lot of these individuals who are essential workers, and documentation.
That's the situation with Maria. She was able to get her first dose during a hospital stay, but can't get her second because she doesn't have the required Florida driver's license or state-issued ID. And then there are people who don't trust the vaccine, the drug makers and the government. And you don't have to look far back to see why that distrust runs so deep for many Spanish-speaking women. 1970s California and the landmark case Madrigal v. Quilligan. 10 working-class Mexican-origin women sued Los Angeles County General Hospital, saying they'd been coerced into getting their tubes tied minutes to hours after undergoing C-sections. It doesn't end there. September 2020, a whistleblower complained of forced hysterectomies on women detained in ICE facilities. It fuels skepticism that isn't isolated to one region.
Those resonates in people's mind. Is this vaccine going to make me sterile? Is this a way for the government to make us not to be able to have children, right? Children being a wealth of our community.
Battling the doubt isn't easy. For Dr. Martinez Bianchi, it means spending extra hours out in her community to help.
This weekend, we vaccinated 2,075 Latinos in six churches and a credit union, the Latino credit union. And then I realized, but we have 90,000 people that haven't gotten a vaccine yet.
Hayward, California, the trust is there if it's coming from La Familia, a multicultural organization with a 40-year track record of engagement in the Latino community. They've been working with FEMA and the state to be a trust broker of sorts for vaccines.
If they didn't want to take it 2-3 weeks from now, as they find out that family members have taken the vaccine, they feel more comfortable and they're taking it.
Their staff calls hundreds a day in Spanish, focusing on cultural competency and language. CEO Aaron Ortiz says it's key to their successful turnout.
So how many people have you vaccinated here total, and how many of them are Latino or Latina?
So total that have taken the vaccine here, close to 3,200 with a week and a half. 80 to 90% of the people that have been vaccinated here have been Latinos.
About a third of the people getting vaccinated at community healthcare centers are members of the Latinx population, which is a lot higher compared to the national average of Latinos getting vaccinated at these mass vaccination sites, which sits at about 11%.
But the trust in Hayward isn't as commonplace as it should be, Martinez Bianchi says.
We need to take it away from the people's hesitation to the trustworthiness of government systems, trustworthiness of health systems, and providers of vaccine.
Moving forward, analysts think that Latino vaccination numbers could get better, but it will really vary depending on the experiences people have had with the healthcare industry where they live. For Newsy, I'm Lindsay Thies reporting.